Welcome to Minding Men. I'm your host, Brian Pollack. Today, we are going to talk about males and the access to treatment that seems to be sometimes difficult for them or possibly not even available. We might also go into topics around being a father to a young boy or children that identify as male as well. Today's guest is the esteemed Douglas Bunnell, a psychologist in Westport, Connecticut, as well as in New York City. He has been practicing in the field of eating disorders, particularly for 30 years. He's a fellow of the Academy for Eating Disorders, as well as a certified eating disorder specialist supervisor by the International Association for Eating Disorder Professionals. He additionally co-authors books as well as speaks nationally on topics around treatment, males, accessibility, as well as many other different facets of mental health. Doug, Dr. Bunnell, I am so happy you're here. I cannot thank you enough. Welcome.
Thank you very much, Brian. I'm really excited to be here. And I think this topic that we're going to dive into a bit here is sort of under discussed. So I think it's really relevant and I'm glad to be here.
Great. I agree. I couldn't agree with you more. We have talked for the past couple of months actually on many different topics, and I'm really excited because I think we both have come to this idea, if we haven't already been there, that guys just seem to not get treatment when they need it, or possibly it's not noted, or often we don't know where to turn. Can you tell us a little bit more about what you see and what you experience?
Yeah, and first off, I'd just say all of the above to what you just briefly outlined. I mean, let's just start with no order of priority. I think men, boys, maturing into men, still don't get noticed and detected in a way. They don't get referred for treatment. There's not sort of a level of vigilance or attention to sort of male distress in a way. So I think that's, boys' emotional issues can sometimes hide in plain sight, or they're hiding in things that get dismissed as bad behavior or just boys being boys and things like that. So there's sort of a fog around detecting some of these issues in boys and men. There are institutional or sort of just programmatic barriers to treatment, just not staffed with people who are specialized or have had experience treating men. There are issues in training of clinicians, many of whom at least, particularly in our specialty field of eating disorders, have rarely had the opportunity to work with men. So it's sort of it's not something clinicians, even experienced clinicians, generally have a lot of experience with. And then there's this whole very broad issue of stigma, which I know we'll speak more about, but there are prices to be paid, if you will, for men to put their hands up and say, I need help. Without, I want to caveat, I guess, as we get into this, we're going to talk about gender norms and gender expectations, and we'll inevitably speak about this in sort of binary or absolute terms. There's a whole continuum of gender and gender expectations that I think we're much, thankfully, more attuned to now than we were even a couple of years ago. But I still think, speaking generally, that boys are socialized, and there may be sort of inherent biological or temperamental issues involved here too, but boys are generally socialized to not speak up about what's going on emotionally. So if that starts early and is reinforced often, you can imagine that a boy hits trouble with anxiety or depression or an eating disorder in our specialty, he is less likely to metaphorically or literally raise his hand and say, I need help. So we can dive into that aspect of it, but if I had to put my finger on the major issue in terms of what keeps men out of treatment, it would be this sort of stigma barrier to access to care.
So I almost wonder if one almost enables or leads into the other. So you had mentioned that particularly in the field we focus on, but also I think in general, possibly not substance abuse as much, but let's say depression, anxiety, and other facets, it is stigmatized in a way where talking about emotions, talking about what's going on, even just the idea of verbalizing and communicating for men is really difficult for many people who struggle. And if
Right.
we're socialized, going back to that last point, to possibly not express that or not be able to be connecting in a way where people can understand us,
Right.
I can imagine like kind of one is feeding the other in the way that we
Exactly.
are able to assist.
Right. Right. So I think there's that interaction between, to the extent this is still largely true, not universally true, that we respond to boys' emotional pain differently than we respond to girls' emotional pain.
Okay?
Boys, I mean, there's some interesting research on this, that boys actually early on, I mean, like very early on, are actually apparently more relational and sort of more connected in some ways, both in terms of biorhythms and things like that, to their mothers. But somehow they get sort of pushed out of that by the culture, by development, by whatever. So I think there's a case to be made that boys come into adolescence and young adulthood, perhaps less practiced at articulating their inner experiences, like what they're really thinking and feeling. So there's less opportunity to do that. They become less, or they never develop as much capability to do that as their female counterparts. And then you have the whole cultural overlay, which says, good, don't talk about that. Or if you do talk about it, you're going to pay the price of being labeled the conventional things, like you're weak, or you're too fragile, or suck it up, or I'm sure every man on this call or in this meeting, and every woman who knows a man, knows sort of that masculine code of what men are supposed to be. And even if you don't believe it rationally, like I'm fairly aged at this point, but I sort of, I mean, you still feel it in your core, like you have that flinch reaction, like it's just a flesh wound. Don't 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 sort of ask for help, don't acknowledge what you hurt, what hurts you. And you can imagine if someone's depressed, if they're in this era of COVID and all the loss and grief and anxiety that we're all bathed in right now, men are suffering too. And I think we're probably not still tuning into just how that shows up in men. As well as I do, that just take depression, for instance. And I know we have an online resource we might want to direct people to, but depression shows up differently in men. The presenting symptoms, if you will, for men are different than the presenting symptoms for women. Men will often have some sort of physical pain and irritability and anger and things like that, and it's less of that sort of withdrawn, shut down sadness. So, I mean, to be gender sort of focused, you need to sort of know what some of these differences are.
Absolutely. And with that type of awareness and know-how, I almost feel as though the guys or even boys, adults going in, the whole spectrum of age doesn't matter really here. I don't think we even know how to help a guy open up. I I wonder if there's a different language, nuances, nothing majorly different, but nuances.
That's an excellent point. I think there is something to that. I mean, this is a bit into the weeds, so I'm not sure how interesting this will be to most people on this. But if you actually think about just your conventional, do a check. If you sort of think of the prototypic example of someone in psychotherapy, it's often the things that we value in psychotherapy. So you ask therapists, what do you want from a patient? You want emotional expressiveness. You want sort of relational connection. You want people who are introspective and sort of willing to sort of speak in sort of be comfortable in the ambiguity of the human condition, like really to speak about all the stuff that goes on inside you. That's not something that, generally speaking, boys are encouraged to do. Mm-hmm. And again, I'm speaking generally, and
absolutely,
don't want to be criticized for caricaturing men, but I think that's still largely true. So I think the language of psychotherapy is fairly feminized, and at the nuance level, I think if a man comes into session and the therapist is immediately talking about make yourself vulnerable, make yourself connected, make yourself sort of expressive, I want to hear more about what you're really worried about. Those are not things that someone, generally in this caricature, men who are socialized to sort of be more self-reliant and stoic and self-contained, they're going to spark to. In fact, we think it actually pushes people out of treatment. Men men don't enter treatment as frequently. They drop out of treatment more frequently. If they do stay in treatment, they're sort of in for less, they don't stay in quite as long as women. So there are issues here that do probably reduce the effectiveness of our existing treatments for men, just at that sort of stigma barrier level.
Absolutely. And there's researchers nowadays starting to look into this and build some type of awareness around the stigma. There's some great, I don't want to call them old school because they're kind of new in the past 15, 20 years, people doing stuff. But I think really, if you want to find ways to understand how men possibly need a different language, there's a lot of wonderful work around gender conflict and roles, as well as
sort of gender norm adherence, like how there are actually measures for this. A little controversial, but to the extent that you really tightly adhere to the conventional tenets of masculinity, we know there are all sorts of negative health outcomes associated with that. So you can't say that it's causal, but the correlation is there. And this goes well beyond behavioral health. This is into sort of medical conditions too. Men who rigidly adhere to traditional masculine gender norms actually don't go to the doctor, broadly defined, not just the psychologist or the social worker or the psychiatrist. They're not going to their physicians, because on some level it does violate the code, and it's a simplistic way to put it, but it's a pretty powerful code.
Absolutely. And that code is so ingrained. I mean, you can outline in things like success, power, and control, stoicism, strength, muscularity, that kind of onus of power.
We should too. I mean, I'm
some of it can be
biased. There are positive aspects to the masculine code too. So let's not sort of baby bathwater that. But and so there's a self-sacrificing sort of for the other piece to it sometimes that is really, or can be really powerful. You can actually leverage that in trying to help men be more comfortable in coming into treatment. Like, okay, don't do it for yourself. Do it for your wife. Do it for your kids. Do it for your mom, your dad. They know you're suffering. They see it. They're suffering. Okay, I get it. You don't really see this as something that's important, but can you take these first couple of steps just on spec to help the people you love?
Absolutely. And is it important right now to go possibly take a week or two off in order to take care of this for work?
Right.
Do it for the betterment. And that's it's part of the code. It is about digging deep and being connected to make sure you're providing in a way.
Yeah.
It's just the framework of it. And I'm really glad you point that out. It's such a great point. It's interesting. You had mentioned also that part of the code is not going to their physician and not going to make sure that medically men feel okay. If everything's okay, then everything's okay.
Right.
We both, I know, have seen that men particularly don't enter, let's call it hospital treatment or program treatment, but even therapy, unless there is a really noticeable problem.
Right. Right. So again, in our unique, not unique, but our specialty, I mean, men with eating disorders, and there are, people who doubt this, there are a substantial number of men with eating disorders, way more than we used to think. Mm-hmm. But what we do know is that they do come into treatment at a later stage of the illness. So they may actually present for treatment or assessment, usually quite a bit more impaired than women or girls. Because they've sort of either been not detected, no one thought this could be an eating disorder, so we better get him referred, or there's, as you say, there's sort of this, it's not important, or I don't want to do it. And within the somewhat uniquely eating disorders, but not entirely, there's a perception for a lot of men with eating disorders that their eating disorder is not real, it's not significant because it's a woman's disorder, because that's the popular mythology about eating disorders. So we hear that all the time. And then, as you say, it's reflected in the programs because there are arguably fewer men who have eating disorders, even fewer men come into treatment for eating disorders. So even if you are the man who comes forward, you may be one or two there may be one or two men in any given program at any given time. So they're sitting in a room of, in these days, almost exclusively female therapists, female clinicians, nutritionists, and so forth. So, I think that's not insurmountable by any means, but I think it's important for us to be aware of that as another barrier to entry,
Absolutely.
barrier to engagement, really.
Yeah. And we completely need more men in this field. Eating disorders, mental health, the whole rigmarole. There has to be a conversation here that we can sit in a room with guys and girls and be able to not just say, how do you feel about that, but be able to get to the point of where they can express what they're feeling. You can ask, how do you feel? But at the same time, sometimes guys don't really respond to that. It feels invasive, vulnerable.
Again, sort of the risk of making it too simplistic or caricaturing people. I mean, I think in general with men to sort of make tweaks in the process to make it a little less difficult for men to engage in treatment. You do want to, as a clinician, adopt a slightly more collaborative sort of stance, like we're doing this together, to make it a little more problem focused and problem solution, to not dive right into the emotional expression. Right. In some forms of psychotherapy, you're talking often about the relationship between the clinician and the patient or client. There's some suggestion that doing that with men prematurely, they'll sort of say, I'm out of here. You're better off sort of like not going there quite as quickly. And these are sort of like the nuanced little tweaks that, in terms of engaging men in psychotherapy, that I think are important. But I think if we flip it on its head, though, Brian, it's important to stress that the treatments we have for eating disorders, for depression, for anxiety, for any of the mental health, trauma, PTSD, there's not a lot of difference in the effectiveness of these treatments based on gender. So the treatments work. So we're talking about we don't have to sort of invent something brand new, but we look at the dropout rates and the completion rates and things like that. We see men are not getting the benefit of the treatments we do have, and there are things we can do to mitigate that.
Yeah. A funny part of me just goes, well, it's just the marketing, but it's not always just the marketing. There's a lot more to it,
Well, there's always the chicken or egg thing with marketing. It's like the marketing actually reflects popular perceptions. Like the marketers have distilled it down to a image or a tagline or something, but they didn't come up with it out of the blue. They actually are reflecting the culture back to us. But that's a whole other discussion.
Absolutely. And so to steer away from that, we've seen all kinds of different experiences with men. We've talked a little bit about the program. We've talked about male culture. And yes, absolutely. There's very dynamic interventions. There's dynamic programs out there. There's more coming and we need more. So if you're listening to this and you are thinking about doing a program, do it. But, when we look at the idea of acculturating our boys, or helping our boys understand that anger can be handled and expressed, or even our families and the people around our boys, that anger could be part of an expressive means and not to shut down, or not just something that we kind of stigmatize because boys get angry. Can you give us a few ideas of what you've seen across your travels?
Well, one thing that comes to mind is I think, again, clinicians who have not worked often with men get a man comes into treatment and may sort of be more like the anger quotient is higher. Yes. And it's a little, if you're not used to it, or you don't expect it, or you don't have a frame of reference for it, it may be sort of, uncomfortable and disconcerting, and that gets reflected back to the man, and off he goes. So I think anger is the way anger is expressed is fairly gendered, and I think it's it's an issue for clinicians to actually be aware of, get some supervision on. If you're asking like how can we help men be more or improve their ability to articulate what they're feeling angry about, I'm not sure I have any like
no that's
panacea for that one.
I think I'm more asking about, when we well, let's go to your anger comment about being okay with anger. I have seen in treatment centers that when we assess for a gentleman to join the treatment center, one
Uh,
of the big things that people start to worry about is how is this person going to express their emotions? Does it come through as anger? And is that going to scare or offend the other, let's say, females or even more, I don't know, emotionally available or
yeah,
fragile individuals that are part of the experience?
right.
And I think it's something that often we disclude men for their anger because we just don't know what to do with it.
I think that's true. I mean, I think to be fair or balanced, you know, men do express a lot of what they feel through anger, and that often does lead into violence or something that's harmful. It could be verbal violence or and things like that. So some of those concerns are well founded.
Oh,
And as
absolutely.
you well know, a lot of people in programs like this have prior experiences of being hurt one way or the other in relationships. So it's not, it is an issue, but I think just to name it and say, acknowledge that it's a concern or something we have to pay attention to is already a step forward.
Yeah.
Um, and, again, back to the masculine code, if a man's sad and anxious, much more it's much more in line with the masculine norm to punch a wall at that point than it is to say, you know, I'm really sad or I miss my mom or whatever the
Yeah.
real feeling might be. So I think just to start to help men in therapy sort of acknowledge that their anger is a reasonable reaction. It's the behavior that's the problem or the potential problem.
Yeah. I just wish there were, those places where you can go and you can smash things in a room. You pay a lot of money. They have them in like Manhattan.
Yeah.
Sometimes that feeds right into the gender norm to get things out. There are people that do that as therapy.
Right.
Um, and then that's okay.
I'm not up to
No, I
date
know
on
you're
the
not.
reason.
No, you're not. No, I
I
just,
think actually that there's some evidence that actually makes people angrier. It doesn't actually,
oh,
this
I
whole
can
notion that
imagine.
we bleed off anger doesn't actually seem to work that well. But
Yeah, and not to go too far off topic, it was just a
yeah,
funny thought I had. But
but,
you know,
yeah,
there is this part of it where I think we are still as a profession, as clinicians, and as a community trying to normalize the code and the allowance of the code and how we can assist to making that somewhat amenable to the people or the program or the society that we live in.
right. And yeah, I do think things are changing. I mean, I know I'm optimistic that we're much more aware of these issues, and I watch my you know, I'm a grandparent, so I watch my daughter raise her kids, and I see that generation. I think there's a lot more sensitivity and awareness of how what boys need too
Mhm.
emotionally. So I think that's positive. I think the whole binary concept of gender has been blown up. So I think there's a lot more sort of acceptance of variability and where you are in the continuum of that. So hopefully that will lead to some change or some flexibility in the gender norm. And that's really what we're looking for. It's like to decrease rigid adherence to your gender norms. It's like
Yes.
being able to push the edge on that. Doesn't mean you sort of stop being a man if you start to be more expressive. Right? It doesn't mean you're going to be expressive everywhere.
Mhm.
Um, and
Well, may I add, I think that to stick with the code in a way, having those expressive means actually makes you more effective within the code itself. Because I find that when you do allow yourself, whether personally, privately, or in your own kind of community, talking about these things, people adhere to them, people connect with them, and it makes them feel like you're more of a man by
mhm,
talking about these things.
yeah.
And
Well, I'm sure you've had this experience too. I mean, again, I've spent my career working for whatever reason in a subspecialty that is large or has been largely female. So, the percentage of men I see in my practice over the years has, been greater than most people in my specialty, but not substantial. What struck me as I started to see more and more men in treatment is just how primed men actually are to talk about this stuff. Like you
Mm.
don't have to. This is my experience, and I'm curious if you've had it too. Just I find if you actually just create the space where you invite men non-judgmentally to talk about what they're feeling, and
Mhm.
you sort of get beyond sort of the posturing stuff, it just comes out. It's like low-hanging fruit in the sense that they're. And I'm thinking largely in my head of men in their 40s and 50s who are you're running into barriers now. So something's disrupted the path, you know,
Sure.
an illness or a divorce or a job change or something like that. And you actually ask them like how you're feeling, um,
Uh,
a little more in a little more creative way than that, um, and then it just comes out. So I think men are sitting on a lot of men are sitting on a lot of feeling that they just don't know where to go with. Um,
the more we create space for this topic, the more we're going to see some amazing things and hear it from men.
right.
It's so, I mean, you've had your career doing this, as we said, for 30 years. I've been doing this for about 10. And the more I speak with men, there's a whole world that we get to kind of see and experience that I don't think a lot of people do. It's a very private world. It's something actually quite unique and quite interesting and special, dare I say. It's great.
Yeah.
So with that said, we're gonna wrap up the show. I want to say thank you so much, Doug. Is there anything particularly you want to just make a point of that our viewers should make sure to know?
Um, I mean, beyond what we've actually focused on, I think just that um, we should assume that men have the same mental health needs as women. And when we keep seeing that men are a small minority of people actually receiving mental health care, that should jump out at us.
Yeah.
And so I would hope that through programs like this, discussions like this, we somehow at least start to shave away at the stigma around this and make it more acceptable for men, not only for men to say, "Hey, I need help," but for parents to say, "Hey, my son is struggling too. He's not just sort of running around. There's some anxiety disorder there too." So ask your ask your doctor for help. Ask your primary care docs even, or able to screen for lots of these things and can get you a referral to the help you need.
That's wonderful. I learn from you every time I talk to you. I cannot say thank you enough. And if anyone has questions for Dr. Bunnell, please email me at hilltopbehavioralhealth.com and I will forward that message to him directly. And thank you. I really appreciate it. I hope you stay safe out there. And we are honored and lucky to have had a chance to talk with you. Thanks
My
again.
pleasure, Brian. Thanks so much for the opportunity. Appreciate it.
Be well.
Bye.